The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello, TMD warriors. Good afternoon. I'm Tony Urbanic, and this is TMD Demystified, and we are here to talk about temporomandibular joint problems in all aspects, in all ways. Today's topic is a continuation of a generalized topic that I spoke on last time. This is the second in a series that I have begun. I'm not sure exactly how many in the series it's going to work out to be, but this is the second in a series on this in this episode, in this podcast. It's entitled, How Come No One Ever Told Me About This Before? How come nobody ever told me about this before? Meaning, how come nobody ever told me about this treatment? How come nobody ever told me that there was a way to treat TMD that was extremely simple, extremely effective, and that they didn't have to have these symptoms for years and decades? I just walked out of a consultation with a patient. I mean, like 5 minutes ago. And I'm in my Dr. Duds today. I usually wear something else, but I won't go into why I'm seeing patients today on a Tuesday, which I usually don't do, but I'm seeing patients and I got my doctor uniform on. Just recently, this patient had TMD symptoms for 20 years, headaches going back 20 years. Her chief complaint sitting in the chair was, my headaches, they won't go away. I have constant headaches, and once a month I have a supreme headache. I have constant headaches. Once a month I have a killer headache. And she had seen, in a very short period of time, her symptoms, fortunately for her, got out of hand. She had symptoms long before August. This month, I'm speaking to you in October of 2023. In August of 23, she began having severe constant headaches. As it turned out, she has all of the symptoms. On questioning, she has each and every one of the following symptoms except one. Each and every one of these symptoms, and the headaches going back to when she was 20 years old. She is now 40. Symptoms that she said, yes, I have those symptoms, are frequent or recurring headache, earache, jaw pain, neck pain, negative on the ringing, positive on the subjective hearing loss, positive on vertigo, positive on upper back and shoulder pain, arm, hand, finger tingling, and numbness. In fact, she shared with me that her arm was hurting so bad that she thought she was having a heart attack and went to the emergency department. Actually, this is the fourth patient. Doesn't happen too often, granted, but I've had 4 people now say that their chest and arm hurt so much they think they may be having a heart attack, and they go to the emergency department, go to the hospital emergency room, and incur, I don't know what it's going to take, probably a couple $1,000s by the time you go through all the rigmarole of going through the studies and the ECG and the nurses and whatever. You or your insurance company get a couple $1,000 bill. Somebody's going to pay it. When, on examination, I pushed on her jaw joints from the open to the closed position, and she came out of the chair. And she had been seen by several physicians. She had been seen by several dentists. There was a little hem-hawing. This might be TMJ. She had had Botox. She had been on drugs. Her really concern is she didn't like the drugs. She needed to come off the drugs because of the side effects. And she had dry needling from the physical therapist because her shoulder was hurting. I've talked about this so many times. And then you get a patient. Now, this is a new consult I'm speaking of that happened like now 10 minutes ago. I just finished it up. But we have hundreds and hundreds of people who then come back after 6 weeks, sometimes 3 weeks, usually a couple months, and they will say, literally, how come nobody ever told me about this before? Now, the last episode I did focused on the insurance company. They have a part to play in this, and I'll let you go back and review. That's episode number 121, and I focused on insurance companies. The players in this, I also do a blog once a week, a written blog that goes onto our website, our company website, and our practice website, which is, the company website is www.urbanictmj.com. But the players who are responsible to actually give the answer to why nobody ever told me about this includes insurance companies, teaching institutions, hospital and corporate healthcare groups, venture capitalists, the government, federal especially, the physicians and dentists themselves. Patients have a part to play in this, and for sure, Big Pharma. But today we're just going to concentrate a little bit on the teaching institutions, because the part that they have to play, which one way or another literally suppresses the information that needs to be out there so patients can find a real success, a real treatment that is successful and does not make it worse or has side effects that are uncomfortable, and a high degree of resolution. Of course, what I know and what I teach and the way we use this device according to a proper protocol has now been studied in an independent university study, Middle Tennessee State University. You studied it on 3,000 treated patients in an independent study, and found that our success rate, depending on how you define success, whether it be patient's response to different parameters, is between 85 and 95%. Patients or satisfaction of the patients is another way of describing that. Analytically studied, statistically validated. So, what's been going on for the past 60 years? Well, everyone that I mentioned has a part to play in this, including the doctors and the patients, and to why this information is greatly suppressed. So the schools themselves, teaching institutions, and I'm going to read or talk about parts of the written blog that I did just a couple days ago, because I do a blog once a week, article for a blog. But the teaching institutions aren't just dental schools. The teaching institutions can include dental schools, medical schools, schools of nursing, nurse practitioners, schools of physicians' assistants. They don't know anything about it, don't want to confront it, have no interest in it, or if they do have an interest in it, do all kind of weird things using smoke and mirrors to address the problem of TMD, TMJ. And I'd like to address just a few of these independently. I mean, I could, with my experience treating this both surgically for 35 years and non-surgically for 12 years, I have a lot to say about this. And my personal experience is going through dental school, going through medical school. I taught nurses in a nursing program, anatomy physiology, for a year. I did that as a senior in dental school. I had finished dental school early, and I had the opportunity to teach, invited to teach anatomy physiology in an RN program in Indianapolis. And of course, I've lectured several times to continuing education programs to physicians' assistants and nurse practitioners. So I know these groups really, really well. Each of these groups I know really well. I know what they know about TMD or don't know about TMD. I know how they think about it. And I will discuss a little bit of this on an individual basis as it applies to the different kinds of schools. First of all, pretty much everyone who's listening to me now or watching me now went to dental school. And I know without asking you and getting a response that you were told in dental school that the TMJ is an extremely complicated joint. And it's so complicated that you'll probably never figure it out. And because it was complicated and they felt that you never figure it out, they didn't have much to say about it other than it was complicated and they'll never figure it out. And I have talked to hundreds of dentists and said this exact same thing. And not one of those dentists disagreed that they were told it was complicated, it was hard to understand, and we really didn't know anything about it, and it's hard to figure out. So from the get-go, the dental schools really had no interest in it when they should have, because the temporomandibular joint was left to the dental industry, the dental profession, to handle, good or bad, problems or not problems. The medical profession doesn't want anything to do with the temporomandibular joint. If you talk to a physician of any variety and you say TMJ, TMD, I have a joint problem, or I just need to learn a little bit about my temporomandibular joint, they will refer you they'll say, go see your dentist. And so the dentist is supposed to know about this, but you don't. And you don't because the dental schools did not take responsibility for it. And that goes back 50, 60, 70 years to the current day. There is a little bit of enlightenment on the scene, but what has happened, and I stick by this because I am familiar with the few dental schools that have a higher priority for either teaching problems with TMD or having, quote, specialists in their schools that teach both private practitioners and students about TMD, is they spread the problem around to as many different practitioners and sciences as they can, including psychologists and psychiatrists and physical therapists and social workers and surgeons. I speak with authority about surgery, and basically this fell into the lap. In 1970s, this fell into the lap of oral and maxillofacial surgeons because we knew no one else was addressing the problem at all. And the surgeons and the aggressive surgeons and the enlightened surgeons back in the early 70s, myself included, because I finished my oral maxillofacial training in 1976. So from 73 to 76, I was in a residency program at Vanderbilt, very aggressive, top of the line. And we were just beginning to address TMD problems because, well, no one else was. And let's see if we could find a surgical correction for all the pain and discomfort and symptoms that these people come in with, which over the next 30 years was proven to be mostly unsuccessful, whether you do open joint surgery through an incision into the joint or you do arthroscopic surgery. For the most part, we have found as surgeons that there really isn't a solution. If really things go to crap, then the only thing left is a total joint replacement, which is a huge operation. I've done many of them myself, many, and they're fraught with potential complications. You got to be really careful, and you got to be a really good surgeon. And but that is really the only thing that most surgeons are really left with, the very few that are still doing surgery. But the dental profession has literally been dumped on, been given the temporomandibular joint to deal with, and they ignore it. They don't confront it. They haven't confronted it. And the few schools that have want to make it a very complicated issue because I guess they think it's a complicated joint, which is not. And I've talked on that extensively. And that's what's going on with the dental school. No one did this intentionally. Frankly, they did it out of non-confront, not really confronting the problem, and starting with the real issue and understanding the pathology. I think I make a comment about this with the surgeons. Theoretically, it's kind of sounds good if you have you have a bad joint and you open up the joint and you see the meniscus is all damaged and looks like a piece of putty in there. And so you take out the meniscus. That's an easy operation. I've done over 1,000 of those particular operations, remove the meniscus. But a good portion of the time, not all the time, sometimes they don't come back, sometimes they have really good results, but a good portion, 30 to 50% of the time within 2 years, they will be back in your office with continued symptoms, just like they had before, after surgery. And that is why I don't do surgery anymore for temporomandibular joints. And the fact that it sounds good to do, but what the surgeons did not do, and I hold myself responsible for this at that time, is I did not study really what the pathology was that created the symptoms. And there's a whole series of episodes on that, and that is inflammation. Actually, inflammation in the joint creates the symptoms, not the muscles, not this or that. If you have inflammation in the joint, it will on its own individually create headache, earache, jaw pain, neck pain, ringing, fullness, dizziness, upper back and shoulder pain, arm, hand, finger tingling, and numbness. And that is covered extensively, extremely well in other episodes. But this is the history behind why dental schools must take responsibility and answer for the patients that we hear constantly. Why has no one ever told me about this? Well, that's a big reason why nobody ever told me about this, because the dental schools never took any time to learn about it. And they didn't pursue it, which most of the information should have been available and taught on the basic science side of dental school, not the clinical side, not when the patient comes in to the clinic and to see the white coats with the symptoms, because you're past the point of really where the problem is established, which is in cell biology effect in inflammation, which is inflammation in cell biology is a really complicated series of events. You don't have to know everything there is to know. We don't know everything there is to know about the cell biology of inflammation. And I have talked several times in several episodes about that without going into too much detail and boring you to death. But as you probably know, I also have a degree in cell biology and anatomy. That was my additional degree. So dental schools have a big responsibility, and they need to quit just spreading it around so you get so many of the different departments involved. I don't know, it sounds good, or you can make more money at it by having other departments make charges. You get your Department of Psychology, Psychiatry, psychologists. The theory being psychologists and psychiatrists can teach somebody or have somebody so they won't clench or grind. That's bogus. There is no way. We don't even understand the mechanism for clenching or grinding, let alone how to get somebody to stop. That's some of the smoke and mirrors that's out there, but yet that's being promoted in some dental schools, which will go unnamed. And that's just not appropriate. And then next on the list was medical schools. To give you this little vignette, when I was in medical school at Vanderbilt, I was in a specially designed program, oral surgery, oral maxillofacial surgery, internship, residency, medical degree, and PhD in cell biology and anatomy. And while I was in medical school, the dean of the medical school, of course, knew who I was. I didn't know him very well. And he sent a message to me and he said, I'd like you, knowing that I was a dentist and that I was a resident in oral and maxillofacial surgery, I'd like you to do a lecture and teach, do lectures and teach your medical class what they need to know about dentistry, what a physician needs to know about dentistry. And so I sent back a message, how much time do I have? How big a series of lectures do you want? And the message came back to me, 1 hour. I was hoping for more. I do like to teach. And then I literally spent a whole day thinking, how in the heck am I going to distill what I think a physician needs to know about dentistry into 1 hour? Actually, I did try to cover TMD somewhat. It was one of the major topics because if a physician wants to know anything about what dentists teach or do, they don't need to know much about how to do a filling or crown. They need to know more about the other aspects of dentistry, pathology, oral cancer, stuff like that. So I did a lecture, and I don't even remember all the specifics that I covered. That was literally, that's almost 40 years ago, a little more than 40 years ago. But medical doctors, and because I am one, and I know my colleagues in medicine, they don't want anything to do with TMD. If they even feel that anything that the patient may be complaining of has anything to do with this jaw joint, they say, go see your dentist. They don't see, and actually, I was always surprised, they don't go find a specialist in TMD, or they don't say, go see an oral maxillofacial surgeon, which, we oral maxillofacial surgeons kind of held the high ground for 30 years of treating TMD surgically, but physicians routinely just say, go see your dentist. And the dentists don't know anything about it because they weren't taught in dental school. They didn't know anything about how inflammation causes all these symptoms. And the physicians most frequently don't even diagnose it correctly. If the physicians hear about headaches, they think drugs. If their drugs don't work, they send them to a neurologist who has higher power drugs for headaches. And of course, along the way, they spend thousands and thousands of dollars on MRI, CT scans looking for brain tumors. I lectured to 30 family practitioners about 2 years ago in a single room. I had 30 family medical doctors, family practitioners, MDs in a lecture. And I asked them, did a little survey as I lectured. I said, if you have a patient comes in with recurrent bad headaches, what is the first thing you do? And I listed out the different things they could do, which would be, well, think about TMD, think about whatever. And on the list was get a CT scan or an MRI looking for brain tumors. And every hand went up. Every hand went up in the room. 30 doctors. The first thing they do is they spend several $1,000s on an MRI or CT scan looking for brain tumors, which are highly improbable. They can cause bad headaches, no doubt about it, recurrent bad headaches, but highly improbable. Like, I don't know, 1/2 of 1%, 1/10 of 1% of the patients who have bad headaches, probably like 1/10, maybe less than 1/10 of 1% of patients who have bad recurrent headaches have a brain tumor. And no one knew how to press on a joint or ever heard about pressing on a joint and seeing if the joint was hot, i.e. inflamed, that they have TMD. Definition of TMD is inflammation in the joint. So medical doctors, they don't want anything to do with it. So they have a lot of responsibility about how this was suppressed out of ignorance, out of not knowing, in our culture, if you don't, not knowing or not having the understanding is not a justification for not following the law. If I don't understand the tax law, it doesn't make any difference. If I didn't follow the tax law, I'm going to still get nailed by the IRS. If I, just because I didn't see the sign on the side of the road that said, the rate at which I need to be driving is only 35 miles an hour, but I'm doing 55 and I get stopped. It makes no difference that I didn't see the sign or I didn't understand what it meant. I'm still going to get the ticket. I have to take responsibility for not knowing. Why is that not important in dentistry or medicine? If I don't know the speed limit, it's my problem. I still have to take responsibility. So the medical profession definitely has a big responsibility for answering this question. How come no one ever told me about this before? Because the medical doctors don't know. And I had an hour to teach. It's like, why bother? But that happened. It's a fact. that happened. And then you have nurses, nurse practitioners, and physician's assistants. So I taught in a nursing program. I taught anatomy physiology to RN nurses for a year. A lot of fun. They were all farm girls from Indiana. They were really almost all farm girls in the class, and they taught me about farming animals. I think sometimes I learned more about farm animals than they learned about anatomy. But in any case, the nurses, they can't diagnose. Not RNs, and then nurse practitioners and physician's assistants in certain states under certain circumstances can diagnose. But I can tell you one thing about nurse practitioners and physician's assistants. They know they don't know. And they are like sponges, actually. In my experience with talking to those groups, lecturing to those groups, they're really interested. And they take it to heart, and they have a lot of really good questions about TMD, TMJ, the symptoms, what's really going on. And it's a joy to talk to those groups because they're very interested, but they can't, for the most part, run the ship. And so very frequently, even though they may be enlightened about diagnosing it, either they're, incapable of making that diagnosis, or if they can diagnose it, it has to go through higher levels, and the job does not get done. So, but I'm a big supporter of physician's assistants, especially in our current environment, and especially and nowadays everybody 70% of people go to walk-in clinics, not their PCP. If you have a problem, you go to the walk-in clinic, the clinic around the corner. If you have headaches, earaches, and that kind of stuff. And 70% of people who go to convenient care clinics, 70% of those have symptoms, something having to do with the head, in and around the head. And they are seen by physician's assistants primarily. So the medical education system, dental school, medical school, nursing school, we didn't cover TMD at all, or even inflammation to any degree at all, teaching nurses anatomy, physiology, cell biology. But overall, those schools do not address the problem, and therefore they have a lot of responsibility to answer to the patients who say, how come nobody ever told me about this? Because they should know, and ignorance is not an excuse for not knowing. It's not doing. I'm going to quote from my blog, which I wrote last week. It all boils down to the teaching institutions not understanding the importance and prevalence of TMD, TMJ, and expecting someone else to handle the problem. When no one takes responsibility, the void is filled with smoke and mirrors. Let me just digress there a little bit. So that's really what has happened for the past 20, 30, 40 or more years, because the schools, the medical education schools, and I know they're busy. I know they're what they're going to say. We have so much to teach. We have so many things we have to get over. TMJ, TMD is really low on the totem pole. I understand that. You got a lot of information to impart on dental schools, dental students and medical students and nursing students in a short amount of time. But the point is that no one else is going to handle the problem. When no one takes responsibility, the void is filled by smoke and mirrors, and that is where you get the TMD gurus out there, the so-called specialists who claim specialty in treating TMD, that come up with a plethora of non-effective treatments, like the last patient that I mentioned. The patient I mentioned that I just walked out of the room in, who had done Botox and had done needling and had been on multiple kinds of drugs in the span of from August to October for 3 months, and terrible headaches, constant headaches, and took 3 months to get in to see us. And then trying to game the insurance companies, which I mentioned on the last episode. The gurus put this all together and do all this stuff. with the intention of just gaming the insurance companies to get them to pay for it. And I won't go, that was covered last episode. The patients are left to fend for themselves and most frequently go from doctor to doctor, clinic to clinic, ER to ER, and website to website looking for a solution to a problem that teaching institutions prefer to ignore. That's a fact. All right, well, I stated the problem. I stated my rendition of partially who is responsible for how come no one ever told me about this before. And it's just partial responsibility. There are other players, which I mentioned. So it looks like next time we will be covering hospitals and corporate health groups, like large groups of doctors, and hospitals, which are one way or another large groups of doctors. If you'd like to discuss this with me, I'm available, Tony@tmjservices.net. If you'd like to criticize me, I'm available to speak with you. We'll set up a Zoom if you'd like. I can verify everything that I say, and I'm open to criticism for sure, if you'd like to do that. I love communication. I encourage you to communicate about this problem, what you think about it, what you don't think about it. If you'd like to talk to our Director of Marketing and Education, Dr. Naomi Williams, she can be reached at naomi@tmjservices.net. If you'd like to think about becoming a provider for the Urbanic device and protocol, I've had so many people who are now interested in doing the same things that we do to decrease the inflammation, to decrease all the symptoms in a very simple, predictable, and successful way. You can get more information on our website, www.urbanictmj.com or www.urbanictmj.com. And if you'd like to join our network, we will be happy to work with you to enhance your practice, to help your patients. This is a huge problem. Millions of women throughout the United States and beyond wake up every morning with these symptoms, which ruin their life, like the patient that I walked out of the room 20 minutes ago. She said, "This is ruining my life." And then, of course, the day before on Monday, it was my day to see patients. I had a guy that I had not seen for 5 years. He broke his device. He was in it he came to see a new device, and he said, thank you so much. He was a very exuberant kind of guy, but he said, "Thank you so much. This has changed my life." And he was either 4 or 6 years into using the device. All right, enough said to encourage you. Enough said to encourage you to communicate. Enough said, hopefully, for you to think. That's why I do these things, to have the listener actually think independently about what they are told that is not true, that is bogus, that is smoke and mirrors. We got to get out of the smoke and mirrors department. So for today, I'm Tony Urbanic. The title of this blog, webinar is TMD Demystified, and I look forward to speaking with you again in a week.